she's doing it. I am a stroke program coordinator at Sequoia Hospital in Redwood City. And I've been in this, my background is a critical care nurse. And then I joined Sequoia Hospital to manage the stroke program. And Sequoia Hospital is a primary stroke center. So we work with a lot of other stroke centers in San Mateo County. So stroke program it cannot be successful just being standalone. It has to be community help, and the hospitals in the same community. We all need to collaborate. That's why I'm here to talk about. So now I can share my screen here. So let's get started. So stroke awareness and prevention. So we will talk about stroke and types of stroke and risk factors of stroke, prevention of stroke. And signs of stroke, we use acronyms, be fast, tips to help our EMS and emergency room department. And lastly, we will have the time to ask questions. So about stroke, stroke is a leading cause of adult disability and fifth leading cause of death in the US. And part of the brain is damaged due to blockage of blood flow, which is ischemic stroke. We will talk about more. Artery breaks open and bleeds into or around the brain, hemorrhagic stroke. And stroke is also called a CVA, cerebral vascular accident. So US stroke population, we do have pretty much every year 800,000 stroke in the US, which is 40 seconds. Every 40 seconds, someone in the US has a stroke. And every 3 minutes and 14 seconds, someone dies of stroke. And you can see the pie chart on the screen. Ischemic stroke being 690,000, and hemorrhagic stroke is the rest. So the stroke is 87% of strokes are ischemic stroke. As just you see this little blood clot and the fatty tissue. So an artery can become blocked by plaque, a fatty substance, or blood clot. And brain cells require constant delivery of oxygen and glucose. Without enough blood flow, brain cells quickly begin to die. 2 million brain cells die per minute with delay to intervene. And 13% of strokes are hemorrhagic stroke. Hemorrhagic stroke happens when a blood vessel in the brain bursts and spills blood into or around the brain. High blood pressure and aneurysm can make blood vessels weak enough to burst, and that's the most common reason for hemorrhagic stroke. And transient ischemic attack is called TIA, sometimes called a mini stroke, and temporary blockage of blood flow to an area of the brain. Symptoms last for minutes and then disappear. That's pretty much why people actually ignore TIA, because the symptoms are gone. But TIA is a warning sign because 1/3 will have a stroke within a year. 15% of strokes are preceded by TIAs. So we often see the patients coming in and saying that I had TIA, I had symptoms before, and it went away. And then now patient comes back with a full-blown stroke. So 15% of strokes are preceded by TIAs. This is why we educate the TIA patients like ischemic stroke patients. So don't ignore it. So then now we will talk about like risk factors of stroke and how to prevent. So we will go over some this list of the risk factors. This is not including everything that we have, but this is the main cause of stroke and also cardiovascular disease. So risk factors: blood pressure, atrial fibrillation, smoking, cholesterol, diabetes, lack of exercise, also the unhealthy diet, stroke in family, or stroke in the past medical history. So that on the blue is the all the risk factors, and on the very right hand side shows in green, these are the one we are targeting to beat. So blood pressure 120/80, heart rate, regular heartbeat, atrial fibrillation is irregular heart rate, and non-smoker, cholesterol level, total cholesterol less than 200, and maintain the blood glucose, regular exercise, healthy diet, and no, hopefully no stroke in the past. So these are the low risk. So then some risk factors we can control. Some risk factors we cannot control. So the we can control is on the left-hand side: blood pressure, cholesterol, smoking, diabetes, atrial fibrillation. These are the things that we can do something about. But on the right-hand side, age, when you have the stroke data, age is actually, as people get older, stroke incidence is getting higher. So age and gender, family history, ethnicity, prior stroke, TIA, heart attack, this something happened, then we cannot control your past medical history. So we will need to work on all other factors on the right-hand side. So we'll go over a little bit more detail, how to maintain a healthy blood pressure and what is a normal blood pressure. So the blood pressure 120/80, that is like textbook normal blood pressure, 120/80. So if you are plus or minus 10, that should be okay. But more than that, that means you will need to talk to your primary physician, and you will need to have a home blood pressure monitor to check your blood pressure regularly at the same time, like all in the morning before any activities. And also, if you need a medication, then you will need to stay on your medication to maintain the blood pressure in the optimal level. If people are obese, then try to lose weight, and also exercise, and low sodium diet, and healthy diet like fresh fruits and vegetables and whole food. And healthy cholesterol levels, total cholesterol level all you saw is 200, and this is HDL and LDL. HDL is a good cholesterol, LDL is bad cholesterol, and HDL is like omega. So when you eat avocado, salmon, those are the ones help to increase the HDL, and the normal range is greater than 40, and LDL is less than 100. So some of the patients will need medications if the range is outside of this normal range. These are all included most of people's annual checkup. So most of the primary providers at least add this once per year, and it's better to do it in a fasting. So when you go into the primary care, and then they ask you to the annual lab work, and this should be included. And blood sugar control, and fasting plasma glucose less than 100, which means nothing by mouse when you go to your lab work, and that should be less than 100. So that also physical activity definitely helps to lower blood sugar. So recommended time is 150 minutes per week. So like 30 minutes per day. I think that's doable. So these are the ones. So we talked about the risk factors and how to prevent, how to monitor. And this part, we will talk about signs of stroke. And we use BFAST acronyms That's the most common equivalence currently in use. So recognize a stroke, be fast. Initially, we use fast. So the fast is like facial droop, arm weakness, slur speech. So that part was the most common equivalence and many people know about. But the B part, balance and eye, that's the back of your brain, the posterior infarction. And that part, sometimes we are missing to capture stroke symptoms because some of the patients, if they have balance issue, they have eye issue, they go to primary care physician or eye doctor, not thinking there might be a stroke. So that's why we started including B, posterior infarction symptoms, to this acronyms and started educating the community. So B, balance, sudden loss of balance. The nature of all of the signs of stroke are sudden onset. So sudden loss of balance. So it's not like patients having the symptoms feeling off balance for 3 months. That's probably not going to be stroke. Mostly it is sudden onset, feel off balance when walking, feel dizzy, and like the room is spinning or moving. So this sudden onset of balance issue should not be ignored. And I also sudden visual changes. Do you have blurry vision or double vision or vision loss on one or both sides? And this is eye. So this now we went over the posterior infarction symptoms and facial droop. So you can ask the someone who doesn't look right and ask them to smile if their one side is drooping. So that's uneven smile. So the facial droop and arm weakness. And sometimes we can ask them to put their arms in straight and one arm raise both arms, but it's drifting or numbness on the arm. And this is also sudden onset of the arm weakness symptoms. So now be fast as we went over. We went about till arms. So next one is the speech. So listen for slur speech. So this time you can actually ask them to repeat what you say. Like it is raining outside, and the sentence repeated it correctly, or the patient showed the slur speech. So you can check if there's any difference. You will be able to recognize speech part pretty easily because if you know someone, and it can be easily noticeable. And time. So be fast. The last one is time to call for help. The reason the time is this part, I wanted to actually really emphasize that why we need to call 911 instead of coming to the emergency room via private vehicle. When we have the 911, they call our emergency room. They call any stroke center emergency room. And all the stroke centers will be ready when patients are on their way. But if it's a private vehicle, we really don't know whether patient is coming, when patients are going to be arriving, and if they are even coming. So because of that, like the CT scan will be clear for patients. The brain image is the most important diagnostic tool for stroke, and that CT scan will be cleaned, will be ready for use if the patient call 911. So as soon as the patient arrives in the emergency room, patient will be transferred to emergency room right away. If a patient comes in private vehicle, we will be wasting or will be using the several critical minutes or like critical minutes to registering and triaging. So in order to save the time of diagnosing the stroke, call 911 and they will bring patient to the nearest stroke center. Not every hospitals are stroke centers, but they know the stroke centers nearby, so they can take patient to the appropriate level of care of stroke center. So call 911 is really important when stroke symptoms are showing. If you see anyone having stroke symptoms, call 911. So I wanted to share a story that so this is the story that we had in February this year. So the reason I wanted to share this story is 1 minute we delay the 2 million brain cells dying, but also the brain cell dies at different speed per different people. This patient came to the hospital on the present day at 6 o'clock. The patient had a half side of paralysis with a slurred speech. So patient, the stroke scale was really high on arrival to our emergency room. And we quickly recognize the patient that is having stroke, and EMS already called us, patient is coming. So we already ready for patient to have the brain image. So brain image is done like in 2 minutes of arrival. So the best part of actually this patient was came to emergency room really early on. The last known baseline was 45 minutes prior to arrival. So patient had a symptom. It was witnessed by family member, and they call 911. And then patient arrived in emergency room within 45 minutes. So when we did the image, patient had a huge infarction, but the brain cell didn't die. So we were able to use the clot busting medication on that patient in 24 minutes. So patient's stroke scale that we are using is numeric numbers, so we can compare whether patient is getting better or any changes. That number went down to half. So the Sequoia Hospital is the primary stroke center. Our scope of care is providing clot busting medication. But then the patient who need the higher level of care to retrieve the blood clot, if the blood clot is located in the large artery in the brain, that patient can be transferred to comprehensive stroke center, which we have two in the Bay Area, in the San Mateo County, the Radio City Kaiser and Sanford, they are comprehensive stroke center. So we transfer this patient to a comprehensive stroke center, and on arrival, all the teams are ready to do the thrombectomy, retrieving the blood clot. So this patient was able to get the retrieval of the blood clot really quickly. So amazing story is this patient, half the side, paralyzed and slurred speech, went home in 2 days without any neurological deficit. So this story really reminds everyone in our facility, and we've been really lucky that to hear this patient's story. So we contacted Comprehensive Stroke Center, how this patient was doing, and because we collaborate each other. So we heard about this patient who went home without needing any rehabilitation. Patient went home independent and walking. So this is why we have this stroke talk during this community wellness meetings, because if patient comes in late, then brain could have been damaged. But this patient, everyone did the amazing job. Even family member did an amazing job. They called 911, and also the EMT brought patient quickly to the stroke center, and we provided the clot busting medication really timely. So brain cell didn't die when we are doing all the treatment. So the patient's outcome was successful. So with the successful story, I also wanted to share that what would it be helpful to have the what would it be helpful for our EMS or our emergency room to take care of stroke patients fast and timely? remember the when was the last known well time, which means last seen well time, last seen baseline. So I'm gonna rephrase it. Last known well time is when you have a family member, you spoke with them 9 a.m. and then you went outside for a walk and then you came back at 11 a.m. So you've been gone for 2 hours. And then 9 a.m. your family member was completely normal. But when you came back at 11 a.m., you noticed some slurred speech and the weakness on the arm. So which means last known well time, last known baseline time is 9 a.m., not 11 a.m. 11 a.m. is a symptom that you noticed. But if you are actually having the conversation with someone and it was 11 a.m., you are having coffee with your friend, and then you notice the difference all of a sudden, then that's the last known well time and symptom onset time at the same time. Why is it so important? Because the clot busting medication that I mentioned earlier, it has a time sensitive timeline. It's time sensitive. Based on the study, the patients are better if it's within 4.5 hours of window to be treated. If it's outside the window, complications are more prominent. So the benefit is greater if it's treated within the 4.5 hours. Outside the window, we notice the more complications like conversion to bleed and the hemorrhagic stroke. That's why we are very much this time-sensitive treatment to be done within 4.5 hours. That's a thrombolytic therapy. And I also mentioned blood clot retrieval that has a 24 hours window. So that's why there's the it's because these procedures are time sensitive, and that time sense, because that's why we call time is brain. We really want to save the brain tissue, brain cells. And if there's any salvageable brain tissue, we wanted to save it. So patients, their lifestyle and can be protected. So that's why I'm emphasizing, like, just if you notice it, just try to remember when it happens. When was the last time you saw your family or friends being normal? And also the medication list. If patient is on blood thinner because of the irregular heart rhythm, sometimes irregular heart rhythm requires blood thinner. So that knowing the medication list is also very helpful to make a decision whether patient can have clot busting medication. And also medical history. Patient has a high blood pressure on medication, or patient is diabetes, or patient had a recent surgery. So we sometimes give this like medication card to the patients and when they are going home, so they can write their medications and their medical history and then put it into their wallet. Because sometimes we cannot really reach their cell phone if the patient's having all the information on their phone. Sometimes it's locked, we can't really get to it. Then, but oftentimes we are able to access the wallet. And if this medication card is in wallet, then that will be really, really helpful. So this medication card, if you are going into the provider's office, I'm sure oftentimes the primary care office, they have like a medication card. If you don't have it, it's okay to just use a regular paper and write it down as well. So try to keep your medical history accessible. So I think that this is the end of my slide, and I would like to open up the questions. Let me see if any questions on this chat.
Well, for me, it's very informative. It seems like speed is key in helping strokes victim.
Right, time is brain. So I mean, 2 million brain cells dying per minute. And we just have a nursing skills day, and we do go over our success story, and then also like we do go over anything that we can improve even to help better. So we will continue to improve our practice. So anything that you have any questions, let me know.
And cholesterol level, for example, if you have a history of high cholesterol and you've been living with like borderline cholesterol for a long time, how do you reduce it? It's a genetic thing. If your baseline is always 210, is that an issue?
Yes, I mean, having the high cholesterol is definitely an issue, but if you are able to actually maintain it, like not to go high with the diet and exercise, I think that's pretty much applied to everyone. Generic, that's unpersonal, but like that's why family history, we need to know family history as well, because sometimes patients have baseline is high. Same thing with the blood pressure. Their baseline is high. So knowing your baseline, and that is higher than what is recommended because of your generic component. And that's what also what prevention is playing the role with the primary care physician. You probably need to be on medication. You probably need to be on medication for cholesterol and blood pressure, and also exercise and losing weight, and also eating healthy diet, like less saturated fat diet, that helps too.
Mm. Gary has a question. Do strokes happen during or after some activities like vigorous exercise, or do they tend to happen at any time?
They tend to happen anytime. So it's not, sometimes we call it wake up stroke. So patient goes bed at 10 p.m. and then wake up at 6 in the morning with the stroke symptoms. So that's called a wake up stroke. And that happens more than what you think, because when I see the patient when they arrived, oftentimes the arrival time is not between like sleeping time. So it's not like most of the patients comes in before midnight and then after 6 a.m. So patients are falling asleep and not knowing they are having stroke. That's why when we have like a wake up stroke, there's a little bit different treatment. Like we have a different imaging to see if there's any salvageable tissue, if there's any like a large vessel occlusion issue. So there's another extra imaging service will be applied for wake-up stroke patient. So if there's still if a patient can be benefited having the treatment, then patient has options to be treated, but it is still a little bit challenging if the patient is coming outside of the window of the treatment, but it can happen anytime. I see the Carol's question. When taking one's blood pressure at home, what is the ideal time of day to do so? And before a meal, after a meal. So I think that the blood pressure, having the baseline of the blood pressure is better to do it in the morning when you wake up without any activities. And also, if you have a concern, then you can check actually after the activity too, how high it goes up. So I recently visited my parents, and my father started taking the blood pressure medication, and I noticed that he doesn't have a blood pressure machine at home. I gave him a long time ago. I think it's just now no longer working. So I was like, oh no, I gotta buy one. So I just ordered it right away and then have that delivered. And then now most of the blood pressure medications comes with the app. So I installed the app on my father's phone, and then I linked it with the blood pressure medication a blood pressure machine. So whenever he checks, and it automatically goes to his app. So then I told him, whenever you go to the your doctor's office, because he's been asking your blood pressure, how it has been, just show this app, and the blood pressure has been recorded automatically to your app. So I kind of showing him how to use the app and how to use all of this. And then I also told him that like check all in the morning before you do any activity. That will be your probably better indicator as a baseline, and be consistent. Same day, like every day, check the pretty much the same time. Thank you for that question. One of the questions that I have received from previous the community education, I went to the one of the library to teach, and the one question was like, why the atrial fibrillation is a risk factor that we can control. So I had a background of the critical care, and I wanted to say that atrial fibrillation should not be really ignored. The reason it should not be ignored is because the atrial fibrillation is like your heart is like 4 chambers, and 2 chambers on the above and the 2 chambers in the bottom, and the blood comes in to the your atrium. If the atrium like moves like this, so then there's some spots, because this is atrial fibrillation. Usually, like the regular heart is like this, and then bottom, top and bottom, like this. But the atrial fibrillation is like just kind of like moving like this. There's no arterial kick to push all the blood to the ventricle. There's no arterial kick, so which means the blood can stay some spots in your atrium. Then it can make the blood clots. But the problem is atrial fibrillation is like this, and all of a sudden, once in a while, they just have a big giant like push. Then there's a little bit blood clot in the corner, can go to the your ventricle, and they can go to your brain and can go to other places like coronary artery. So that's why the atrial fibrillation, if you feel like you have the irregular heart rhythm, and don't ignore it. Just go to your primary care physician, have them to check your EKG, and atrial fibrillation can be treated either medication or ablation, like electronic cauterization. So there's a way to treat the atrial fibrillation, and atrial fibrillation is quite common cause of the stroke. So if you have a cardiologist in your care team, have them look at it, have them look at you, check your heart rhythm. So that will be one of the main like cause. So and also it's preventable, and you can do something about it too. And how you know you have the like irregular heart rhythm? So like our thumb has their own pulse. So don't use your thumb, just use your 2 fingers or 3 fingers. And then you can put like under the thumb area, you can put 3 fingers, and then like here. And then if you just to see it, if your heart rate is regularly just moving, is it just regular, or it has like bam, bump, 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 and then there's a skipping bit. And that's kind of irregular heart rhythm. So that's how you're able to recognize if you had the irregular, or sometimes you feel it. We don't usually feel our heartbeat, our own heartbeat, but if you feel your own heartbeat and that is pumping irregularly, and that's also concerning. So you can definitely check with your primary physician. That was a question I have received from the previous education session in the library.
Any other questions?
Don't be shy.
Okay. Well, thank you so much, Joanne. This is amazing. Thank you. This has been very, very informative for us.
Thank you. Thank you so much for having me, and thank you for listening with all great questions.
Yeah, and thank you, Janelle, for introducing us to you. So thank you. Okay, take care.
You are welcome. It was a real pleasure. I can't get enough of this presentation. So anyway, Joanne, you're great. And we are so grateful for this invitation, Tina. So thank you.
Thank you. Take care.
Thank you.
Bye-bye.
Bye.